Hi, my name is Kathy Moses. The purpose of this presentation is to bring awareness to psoriasis. Psoriasis is a common skin condition that speeds up the life cycle of skin cells. It causes cells to build up rapidly on the surface of the skin. The extra skin cells form scales that are itchy and, trust me, extremely painful. I know this because I've been dealing with this chronic, in my case, debilitating disease, which has covered over 80% of my body for the past 22 years. As I do this presentation, I am itching uncontrollably, but I must carry on. There are some well-known celebrities that share this skin condition. Kim Kardashian West, her mom, Kris Jenner, LeAnn Rimes, Cyndi Lauper, uh, Stacey London, comedian Jon Lovitz, and pro golfer Phil Mickelson, just to name a few. Psoriasis can develop at any age, but it normally attacks between the ages of 15 and 35. About 1.9% of African Americans have psoriasis compared to 3.6% of Caucasians. And according to the current studies, more than 8 million Americans deal with psoriasis. Psoriasis is an autoimmune disease, meaning that parts of the body's own immune system becomes overactive and attacks normal tissues in the body. People often ask me, is psoriasis contagious? Psoriasis is not contagious, but studies have shown that having one parent with psoriasis increases your risk of getting the disease, and having two parents with psoriasis increase your risk even more. Psoriasis causes a thick red skin and silvery scales, and they are typically found on the elbows, your knees, your face, in your head, the palms of your hand, the sole of your feet, but can also affect places like your arms, your legs, and even your mouth. Psoriatic arthritis is an inflammatory type of arthritis that eventually occurs in 10 to 20% of people with psoriasis. It is different from more common types of arthritis such as osteoarthritis and rheumatoid arthritis, and is thought to be related to underlying problems of psoriasis. Psoriasis and psoriatic arthritis are sometimes known as psoriatic disease. Psoriasis has a typical appearance that a primary care doctor can recognize, but it can be confused with other skin diseases such as eczema. So a dermatologist is often the best doctor to diagnose it. And psoriatic arthritis has many of the same symptoms as other types of arthritis, so a rheumatologist is often the best doctor to diagnose it. The treatment of psoriasis normally depends on how much skin is affected or how bad the disease is or the location, especially on the face. Treatments range from creams, ointments, ultraviolet light, to biologic drugs that you see daily on TV commercials, such as Totes, Cosentyx, Stelara, Humira, Remicade, and Enbrel. Many people have psoriasis have other serious health problems such as heart disease, diabetes, and even depression. Some foods you want to avoid if you have psoriasis are red meats, dairy, especially eggs, wheat, rye, processed foods, alcohol, smoking, tomatoes, and pasta. Other triggers include cold and dry weather. Such weather can dry out your skin, which makes the chance of having a flare-up even worse. Stress causes psoriasis, some medication, infections, trauma to your skin, smoking and cigarette smoke, sunburn, dryness, and allergy. But one of the most frustrating things about treating psoriasis is that sometimes that works well for one person, but it may not work at all for another. It may take some time to find the right combination of therapies that works best for you. With psoriasis, slow and steady wins the race. Thank you.